influenza, salmonellosis, Ebola, Rift Valley fever. Many infectious diseases come from animals. But how big a worry are these zoonotic diseases? Hi, I'm Luciana Lepore and I'm an infectious disease specialist. Over the last few years, I've been working in the Emerging Infectious Disease Unit in the Public Health Department of the Institute of Tropical Medicine in Antwerp. Zoonotic diseases can be transmitted between animals and humans, and they constitute a big portion of infectious diseases, which are caused by bacteria, viruses, parasites, and other pathogens. An estimated 60% of known infectious diseases are considered zoonoses, at least in origin. And this begs the question, how exactly are these zoonotic diseases transmitted to humans? Vector-borne diseases are diseases which are transmitted to humans by the bite of a tick or a mosquito or a flea. They account for more than 70% of all infectious diseases, and they can cause more than 700,000 of deaths per year. Among the most well-known, there is, for example, malaria or yellow fever, while others are increasingly known like dengue, Zika, chikungunya. Among vector-borne diseases, leishmaniasis is one example of zoonotic diseases, which is perhaps more familiar among dog owners. This disease is indeed transmitted via the bite of a sandfly to humans from an infected dog. A second way of transmission is via food, and it can occur while eating or drinking something unsafe. For instance, toxoplasmosis can be transmitted while eating unwashed vegetables or fruits which have been in contact with soil contaminated with the feces of infected cats, for example. Foodborne transmission can also occur while drinking unpasteurized raw milk or eating undercooked or raw meat or eggs. It is a complex cycle here in which we are all included, no exceptions. Another way of transmission is while drinking or being in contact with water which has been contaminated with feces or urines from infected animal. Waterborne transmission occurs primarily in settings with poor hygiene and sanitation, where access to safe water is challenged by water scarcity, drought and climate change, war and conflicts, natural disasters, inequities and poverty. Direct transmission can occur when people are directly in contact with contagious blood or saliva or other fluids from infected animals. This can also occur when getting bitten or scratched by infected animals, and clearly this puts people working with animals at higher risk. As an example, cat scratch disease is a disease that affects primarily our lymph nodes. Rabies is another example of direct transmission. Rabies occurs in more than 150 countries and territories, causing tens of thousands of deaths. Zoonotic diseases can also be transmitted indirectly when people are exposed to contaminated animal areas or in contact with contaminated surfaces. An example of indirect transmission is avian influenza, caused by influenza viruses, some strain of which can occasionally infect humans. This happens mostly via close contact with infected birds. Bird flu mostly affects wild and domestic birds, poultry, with big impacts on animal health, as well as human health. Presently, it is a global public health concern, requiring vigilance and surveillance. At ITM, with our research and daily activity, we try to better understand the human-animal environmental interface. This approach is known as One Health, in which the health of humans is closely connected with animal health in a shared environment. Want to know more about zoonotic diseases? Listen to our podcast.